Good morning, everyone, and thank you for joining us. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health, Chief Darren Rizzi from Mississauga Fire and Emergency Services, and Chris Giles, our Manager of Compliance and Licensing Enforcement for the City of Mississauga. Before I give my COVID update, I just want to say that right now, my thoughts are with those in our community who have loved ones in Afghanistan. The images and stories coming out of that country are heartbreaking, and I can only imagine the deep concern that those with family and friends in the region must be feeling. On behalf of the City of Mississauga, our thoughts are with the Afghani people and those in our community impacted by the situation on the ground. I called this press conference today because the COVID-19 situation in our city and across the province is entering a new phase. Many health experts believe we are now in a fourth wave of this virus, driven by the Delta variant. And I strongly believe that more needs to be done across the province to limit the impact of the fourth wave. When I gave my last update on July 22nd, Peel Region was averaging 5 cases per 100,000, and Mississauga was averaging 4 cases per 100,000. Those numbers have increased significantly, with Peel Region now averaging 15 cases per 100,000, and Mississauga even higher at 18 cases per 100,000. On July 22nd, Peel's R factor, the single most important indicator of community transmission, was at 0.75. Today, it sits at 1.3, meaning that for every 100 people who contract COVID in Peel, another 130 individuals will be infected. Thankfully, the situation at our hospitals is relatively stable, with 10 COVID hospitalizations at Trillium Health Partners and 3 patients in the ICU. There are 6 COVID hospitalizations and 2 patients in the ICU at Brampton's William Osler Hospital. 97% of the people who are now being hospitalized because of COVID-19 in Peel Region are either partially vaccinated or unvaccinated altogether. That is 97%. This is largely a pandemic of the unvaccinated today. The rise in COVID cases here in Peel reflects an overall upward trend that's happening right now, right across the province. And I am very concerned. What gives me particular pause is that this upward trend is happening despite the fact that we've made huge progress on the vaccine front. As of August 13th, more than 2.5 million doses of the vaccine have been administered in Peel Region. This translates to 82% of residents 12 plus with at least 1 dose and 71% with 2 doses. I encourage young working adults, 25 to 40 years old, to be sure to go out and get their second dose, as that's the age group where we are seeing the lowest uptake in the vaccine. Despite the incredible efforts so many to be vaccinated, more needs to be done to limit the potential damage of the fourth wave. So today, I'm making an urgent plea to the Ontario government to take immediate action on an important front, and that's to immediately implement a province-wide proof of vaccination program. Health experts, including Dr. Lowe, chambers of commerce, including the Toronto Region Board of Trade, the Mississauga Board of Trade, and Ontario's big city mayors are all in support of one. We are asking for a proof of vaccination program because right now, Ontarians don't have a way to securely prove their vaccination status. The current receipt that people receive after their vaccination contains personal information, including their date of birth and health card information. These receipts can be easily manipulated and falsified. We need a program that provides residents with an easy-to-download proof of vaccination record that they can store on their phones or print out. That includes either a secure barcode or a QR code that protects people's personal information and gives businesses and organizations certainty that they're dealing with a legitimate immunization record. The reality is that we're already seeing many public institutions like University of Toronto, Western University, and Seneca College all requiring that staff and students are vaccinated for in-person learning. Some restaurants, retailers, and concert venues are already requiring people to prove that they've been vaccinated. With all the uncertainty our residents and our businesses have faced over the last 17 months, it's critical that the Ontario government provides them with a reliable proof of vaccination program. But above all else, a reliable proof of vaccination program could be absolutely critical in avoiding the type of devastating blanket closures our businesses have faced over the last 17 months. If COVID cases continue to rise, we may face a situation where certain public health measures may need to be imposed once again. If that's the case, then a proof of vaccination program would give the province and public health the flexibility to put into place targeted measures. Instead of businesses having to close in the face of rising numbers, a proof of vaccination program, for example, could allow non-essential businesses to remain open to only those who are fully vaccinated or have medical exemptions. Policies that we are seeing in many, many other jurisdictions. Now, I know that the idea of requiring proof of vaccination is a sensitive topic, especially for those who have chosen not to be vaccinated. But let's be very clear. The vast majority of us have done our part in getting the vaccine, and we should not be penalized because a small minority of people don't want the vaccine. We can no longer cater to those who are choosing not to be vaccinated, putting all of us at risk, putting our economy at risk. Last week, the federal government pledged to create a vaccination passport for international travel. They also announced commercial air travelers and passengers on interprovincial trains and large marine vessels will also have to be vaccinated. And I'm asking that the Ontario government follow their lead in our province to do the responsible thing and implement a province-wide proof of vaccination program to protect our businesses and our economy. I am encouraged by media reports that later today, the Ontario government will be announcing a vaccine mandate for frontline healthcare workers, including long-term care staff and educators and education staff. I want to thank them for taking action to protect some of our most vulnerable residents. A vaccine mandate for healthcare workers will help ensure that our hospitals have the staffing capacity they need to continue providing vital care to our residents. It will help ensure we don't see a repeat of the devastation that swept through our long-term care centres last year. A vaccine mandate for education workers will provide better protection for our children and all education staff when in-class learning resumes in the next few weeks. It will ease the minds of parents and help ensure that when schools open, they stay open. I once again want to thank the Ontario government for taking action on this front, and I look forward to hearing more details later today. I think you can all tell from my tone today that I'm very worried. Despite the enormous vaccine uptake by residents here in Peel and across Ontario, we remain in a very precarious situation. I urge everyone who hasn't received their first or second dose to do so as soon as possible. And I urge everyone to keep following the advice of public health. Before I ask Dr. Lowe to come up for his update, I just want to say a few words about the federal election campaign that got underway on Sunday. Yesterday, the City of Mississauga launched our campaign called Mississauga Matters to highlight the city's priorities during the upcoming federal election. It is important that candidates, parties, and residents understand what Mississauga needs from the federal government. For this election, we are focused on four main priorities: housing affordability, investments in transit and breaking gridlock, supports for businesses and the community, including tourism, arts, and culture, and investments in sustainable infrastructure. Mississauga cannot tackle these issues ourselves, and we need a committed and engaged federal government to make investments in municipalities and understand our priorities. We encourage all residents to learn about our city's priorities and send a message to their local candidates that Mississauga matters. If you're on social media and want to send a message to candidates, please use the hashtag Mississauga Matters. And as always, no matter who you vote for, I always encourage everyone to vote. As we look around the world, we see just how fortunate we are to have a thriving democracy with free and fair elections, and we must never take that for granted. I'm also speaking a lot about the priorities of Mississauga with provincial cabinet ministers this week at the Association of Municipalities of Ontario's annual conference. Thank you, and I now invite Dr. Lawrence Lowe up to provide his update. Dr. Lowe?
Thank you, Madam Mayor, and good morning. As of last week, Mississauga's case rates are at 18 per 100,000, with test positivity sitting at 2%. The Mayor's call for vaccination certification and mandates this morning is timely, as we have entered our second wave in the region, our fourth wave, in the region of Peel. However, our context is somewhat different. For nearly 1 million Peel residents, over 71% of our eligible population, those with 2-dose protection now, their risk of severe and mortal outcomes has been significantly diminished and their chances of infection reduced. Where uncommon breakthrough infections have occurred, the good news is that they are almost exclusively mild respiratory infections. I want to also take this opportunity to make clear what is meant by a wave, in particular our fourth. Each wave is made up of positive cases. Each positive case is occurring in a person who lives in Peel. And in this start to our fourth wave, it is increasingly clear that those who are testing positive and getting sick are people who are unvaccinated and often becoming severely ill with Delta. In essence, these are not waves like a tsunami, which happens to the community. It's more like a wave at a baseball game, where audience participation is required to stand up and throw your arms up in the air. So I'm going to make this as simple as I possibly can. If you choose to remain unvaccinated, you are the wave. We recognize that many people face access barriers to vaccination, so we are trying to reduce those barriers for the 260,000 residents that have not yet received a single dose, and the 120,000 residents who have at least one dose on board but need a second. but we need your help to ensure that everyone gets to 2 doses. Vaccination is the key to limiting severity for yourself and for the community as we enter this 4th wave. And as we do at this point in the pandemic, our high vaccination coverage gives us 2 options to continue to control transmission in our community. We could continue to treat all individuals and settings as having the same risk of spreading the virus and experiencing severity and mortality. This is why previous closures and lockdowns were needed in previous waves where our population was largely unvaccinated. However, we could instead recognize that vaccination status is now the major predictor of outcomes with COVID-19 infection and put in place measures to protect those who are at greatest risks of severity, which remain our unvaccinated and undervaccinated residents. In the immediate term, a vaccination certification could continue to allow businesses to stay open and support large events by limiting risk for those who remain unvaccinated, especially in venues and areas where measures like masking cannot be consistently observed. Requiring vaccination in certain settings with populations at risk of severity, such as in long-term care or in healthcare facilities, or where there is a susceptible population that hasn't been vaccinated yet, such as in schools, would also help to limit introductions and spread. And finally, with vaccination as the foundation, maintaining universal measures such as masking indoors, distancing, testing, and worker protections adds another layer of protection for those who are unvaccinated, especially if mild breakthrough infections occur. Again, the previous lockdowns and closures were required in certain settings because certain settings were identified as high risk, and also our population was largely unvaccinated. That meant anyone was susceptible, and it was impossible to determine who might suffer from severe outcomes. With a safe and effective vaccine that has now been widely deployed, a comprehensive vaccination policy on top of universal measures will continue to limit the spread and the size of the 4th wave in our community by protecting our unvaccinated populations. So at this juncture, I urge you all to do your part to keep our community open and to stay safe. Get vaccinated, stick to the precautions, and don't become part of the 4th wave driven by Delta. Thank you, and I'll pass it back to Mayor Crombie.
Thank you, Dr. Lowe, and all of us, Dr. Lowe, myself, Chief Rizzi, and Chris Stiles are here and available to answer your questions.
Your first question comes from Courtney Heels at CP24. Go ahead, Courtney.
Morning, Courtney.
Morning. Good morning. My question's for Dr. Lowe on
no
the call now for proof of the vaccine program from the province. Dr. Lowe, you called this timely. I'm wondering if you could give us a sense of how much time we have now before we could start to see a spike in COVID cases, especially in the unvaccinated, and perhaps even further lockdowns as a result if we don't see this vaccine program.
Yeah, Courtney, it's difficult to predict that with any certainty because we do have high vaccination coverage rates, which affords a significant level of protection, our 1 million residents with 2 doses. But we do know that there are still 260,000 residents who are unvaccinated and 120,000 who are eligible for a second dose after having had their first. And those are some large numbers. We certainly want to make sure that those that are unvaccinated and undervaccinated are protected as much as possible. So I would say as long as there is an opportunity, as soon as there's an opportunity to provide that, that remains one tool that allows us to engage as case and transmission and contact numbers go up. That provides us one tool to allow identification as to vaccination status. And it is worth noting as well that, as this disease becomes less less novel, whether that would need to be continued is a question altogether. But in the immediate term, our choice is really between treating everyone as susceptible or recognizing that the vaccines are safe and effective and differentiating on that status. Thanks so much for the question.
And thank you. My follow-up is also for you, Dr. Lowe.
Yep, no problem.
Crombie, if you'd like to weigh in. We'd love to get reaction to the Canadian press reporting that Ontario is going to announce this vaccine policy. We're hearing that healthcare and education workers will either have to show proof of a vaccine or they'll have to be tested often for the virus. So it doesn't sound like it's a mandate, but they'll have one of those options available to them. I'm wondering, do you think this will go far enough to prevent, again, a significant fourth wave and maybe even overwhelming numbers in the hospital?
Yeah, absolutely. So I would say I'm generally supportive of vaccination requirements in two major instances. First, in situations where there are individuals who may be rendered more vulnerable due to the disease, and therefore you're really trying to prevent introduction in those settings. So, for example, in healthcare settings, in long-term care settings, if you're trying to prevent introduction, certainly vaccination is one way, and certainly testing is another way that would actually ensure that an individual that is positive, for example, is not being cared for by a staff member. So I think that's one setting where there are people who are vulnerable and need to be protected from COVID-19. The other setting is settings where there are large groups of people gathering who may be unvaccinated. So you think about things like large settings, certainly schools where a large proportion of the under 12 population are still unvaccinated, even in other settings such as in post-secondary institutions where we know, leaving aside Peel, where we have almost 97% coverage of our 18 to 24 population, we know that similar numbers don't exist elsewhere in the province for that segment, and they will be congregating in post-secondary institutions in the fall. So again, wherever there are settings where there are lots of people who are potentially vulnerable to severe outcomes, or lots of settings where there are lots of unvaccinated people, those are settings where measures such as a requirement would be helpful. And I will wait to see certainly, and we will study what decisions get announced by the province today as certainly as to its effectiveness and timeliness. Thanks so much for the question.
Thank you, Courtney. So it's Mayor Crombie. I would agree with Dr. Lowe, and I congratulate and applaud the provincial government on moving forward with mandatory vaccines for all frontline healthcare workers, in particular those in long-term care homes, and in fact all educators and education staff as well. This is a very important step to keep our children safe and gives parents peace and comfort knowing that educators will be protected and their children will be safe as well. So it's a very important step forward, but I look forward to hearing all the details of the plan and the program, and I'm sure it'll include a component of rapid testing and education as well for those who may not be able to be vaccinated. Thank you.
Your next question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Welcome, Steve.
Mayor Crombie, how are you?
I'm so well, thank you.
Good to hear. I just wanted to ask you about whether the city is considering a vaccination mandate or requirement of its own for, the upwards of 5,000 staff that the city has.
Yeah, it's an excellent question, and it's something that all the chief administrative officers right across the GTA are discussing right now. We're a little bit limited in how we could implement it, and we have to be very careful because, of course, it's a very complex issue. It'd certainly be helpful if the provincial government mandated that all employees of any government agency should be vaccinated to us, but we're certainly studying it, and we're looking for legal interpretations on how we could implement it or what our options are moving forward, whether it would be a combination of vaccinations plus education and rapid testing, because of course there are many of us who are planning to come back to work this fall. Others are not planning to come until the new year, but it's a combination depending on the municipality moving forward on what is best for that municipality and what is our legal, what we have the legal right to do because we don't want to be subject to any sort of charter challenge, of course, as well. So the CAOs are meeting today, and I know that they're looking forward to a legal interpretation on Wednesday, and I think we'll see an announcement starting in Toronto later this week, and I'm very hopeful that they can all come to an agreement so that we have a uniform path forward for all municipalities and all staff of municipalities across the GTHA.
Do you personally feel like it's a better idea or it's safer if the 5,000 some odd city staff in Mississauga are vaccinated or at least tested on a very regular basis?
Yes, of course. That's something I've been advocating for this morning. As you have heard, I think it's very important that all frontline healthcare workers and educators and education staff be vaccinated. And I would say the same is true for government employees, including municipal employees. I know we have a very high rate of uptake on vaccination here at the city, anecdotally speaking. And of course, but we do have to give people options because it is their right to refuse the vaccine. But that would be in combination with education and rapid testing as well.
Your next question comes from Natasha O'Neill at The Pointer. Go ahead, Natasha.
Welcome, Natasha.
Good morning, Mayor Crombie. I actually have two questions for Dr. Lowe this morning.
No problem. I'll bring him up right now. Thank you.
Go ahead, Natasha.
So as we're seeing things down south in the States develop over the past few months, it's pretty clear that they're seeing a big rise in younger patients, and that's mostly due to the fact that 12 and under still can't get vaccinated. Are we in Peel equipped enough with pediatric beds and supplies for kids if this were to occur in the coming months?
Yeah, thanks so much for the question, Natasha. Your question would be better directed at Ontario Health Central Region, which oversees the hospitals and the healthcare response. Certainly for us in public health, our focus is seized outwards in the community, really trying to ensure that as many people get vaccinated as much as possible. For the children under 12, it really is about the adults getting to 2 doses of vaccine, providing a cocoon in addition to measures within the schools such as screening, masking, cohorting, etc., until such time that we can be certainly sure that we're out of the woods to keep things like in-person learning and interactions with family as safe as possible. But in respect of hospital preparedness, your question is better directed at Ontario Health Central Region.
Okay, awesome. Thank you. And now a question about the ongoing election. We know that voting can be done safely, and so can events like rallies. But at what point would you be uncomfortable with these events taking place in Peel specifically? And would you recommend virtual campaigning at all in the coming months?
Yeah, it's a great question. I think a lot of this really is being watched not only in Peel, but certainly across the province. I think we've heard Dr. Moore indicate that we will be staying in step 3 of the roadmap to reopen for the time being, and I imagine certainly anything that would occur in terms of trends, etc., would be in conversation with the provincial CMOH's office, just to really identify at what point or what threshold we would recommend that large gatherings cease. At which point you would presumably anticipate that large gatherings would cease on the part of campaigns. It is worth noting that it's vital for any such gatherings to really follow those measures and those precautions, screening, ensuring you're not attending if you're sick, masking, distancing, preferring the outdoors. All of these are essential to ensuring that these do not become events that lead to broader transmission. And I think to the extent possible, especially when it comes to voting, we would ideally recommend, obviously, that there are options for postal or mail-in ballots. That may be a first pass for most people to consider, although certainly recognizing that there should be other alternatives with health precautions in place for other people to express their right to vote. Thanks so much for the question.
Dr. Lowe, the next 2 questions are actually for you as well.
Okay. Thank you.
And they come from Lysandra Ongarato at MDC Media. Go ahead, Lysandra.
Morning, doctor. So I would like to know, Ontario is about to introduce the vaccination proof to health and educational workers, as you guys already mentioned. Do you think it should be extended to all population, not only these specific groups?
Yeah, thanks so much for the question, Lysandra. I think we're speaking in general, or at least I've indicated, and I'm sure Mayor Crombie would probably weigh in as well. You've got both mandates or requirements in certain settings where individuals are vulnerable or where there's large groups of unvaccinated people. But I think that also, the other side of the coin is the certification question, and then that would be up to the community as to how they wish to use it. We know that the vaccines are safe. We know that they're effective. We know that vaccination status is one of the most significant predictors as to whether you will have a severe outcome, such as death or hospitalization. I think we're talking about two things here. Certainly in certain settings, there will be a need to do things like mandates, either vaccinate or test, just to really ensure that you're avoiding introductions. And then broader for the general population, encouraging as much as possible people to get vaccinated, leaving it to workplaces to determine their own policies in accordance with labor laws. And then for the broader public, really the use of a vaccination certification will hopefully avoid any broad-scale closures or curtailments. Thanks so much for the question.
Doctor,
yeah,
I also have another question.
No problem.
Sorry,
and then I'll have Mayor Crombie come in weigh in because I'm sure she'll want to weigh in.
Okay. Just another question. As you said, we are already in a fourth wave, right, of the pandemic. So do you think it's time to consider like this third dose of the vaccine, as some countries in Europe, for example, are already considering?
Yeah, absolutely. I understand that this is a topic of active discussion, both by the Ministry of Health here in Ontario as well as at the federal level. What we've seen from abroad is contemplation of third doses really is looking at people who don't mount as strong or robust an immune response. So typically those that are older, especially those elderly that live in congregate settings, individuals who may have specific medical conditions that render their immune system less robust. So I understand that those discussions are ongoing. We also do have to remember that there are many places in the world that have yet to see, their first two vaccines. So I imagine any sort of decision that would be taken around a third dose would hopefully be made with those equity considerations in mind, as well as on the specific science and availability of vaccine that's here in Canada. Thanks so much for the question.
Next question, please.
Your next question comes from Pooja Luthra at Y Media. Go ahead, Pooja.
Welcome, Pooja.
Pooja, are you there?
Hello.
Hello. Welcome. Pooja?
Pooja? Oh, let me try to unmute her again. Pooja, are you there?
Yeah, hi. Good morning, Mayor.
Good morning.
I would like to know that, I know I'm repeating myself, like the previous question was also related to the booster shots, but in US, like they are providing the shots to people with weakened immune system. So do you think like we should also do it like not on federal level, but also province-wide to those people who are in a way fully vaccinated, but have, low immunity system?
So, this is a response better provided by a medical person. So I'm going to ask Dr. Lowe to come to the podium, please. But of course, the most vulnerable should be the first in line for any booster program. Dr. Lowe?
Thank you.
Thanks, Madam Mayor. Thanks, Pooja, for the question. As I identified, certainly there is lots of data coming in just around the robustness of an immune response, and contemplation around potential third doses would focus on specific groups for which a response couldn't necessarily be mounted as it would in a healthy individual. Certainly those include some of the more vulnerable individuals that were prioritized during the first two doses of the vaccination rollout. And of course, with the equity consideration that we really do need to consider that this pandemic isn't truly over and that we all remain vulnerable at risk if there are other places that remain that don't reach high vaccination levels overseas. Those tend to be breeding grounds for variants, as has been seen here as well. So I understand that these conversations are occurring amongst our provincial and federal colleagues. I'm certain they'll have some clearer instructions and announcements at some point that will take into account all of those various considerations and factors. Thanks for the question.
Thank you so much. My follow-up is also for Dr. Lowe.
Okay, thank you.
I'm sorry. Yeah, thank you.
Go ahead, Pooja.
Yeah, Dr. Lowe, I would like to know that previously when we were able to identify the hotspots, we were keeping the vaccination rates higher there, like we were providing more vaccine doses there. And then also we were, keeping more restrictions at those places. Right now, do we have anything related to that where we can find out these many people are unvaccinated in particular area and there we can place more restrictions?
Yeah, thanks for the question, Pooja. It's an interesting one. So yes, certainly we are very aware of cold spots in the community that have been identified. Our website, peelregion.ca/coronavirus, you can go to the data dashboard. There is a map that shows different postal code areas in Mississauga, Brampton, and Caledon by postal code and where we have lower rates of vaccination. These are the areas that are part of our last mile strategy for Peel Public Health, where we are now essentially shifting staff over from the large mass vaccination clinics into mobile modalities that are targeting things like bus terminals and grocery stores, just regular everyday places where people are there and really bringing needles to people in these areas that have been identified as cold spots. At this point in time, again, our community levels of transmission don't warrant broad closures or even targeted closures at these neighborhoods, and those would really be seen as a last resort. I think maintaining universal measures such as masking, screening, ensuring that you're spending time outdoors, on top of ensuring that everyone gets to 2 doses of vaccination is going to be most critical, and ensuring that everyone gets to 2 doses of vaccination, using that through a comprehensive vaccine policy that includes mandates as well as certifications to avoid the need for broad scale closures or even targeted closures in places where vaccine uptake is maybe not as optimal as we would like. So certainly that information is all available on our website at peelregion.ca/coronavirus. Thanks so much for the question.
Are there any further questions?
Yes, your final question comes from Khalid Salama at My Second Home TV. Go ahead, Khalid.
Welcome, Khalid.
Thank you, Dani. Thank you, Madam Mayor. Good to see you again.
You too.
One of the 4 main priorities on Mississauga matters is infrastructure. Can you please provide an approximate dollar amount of how much the requirements are in Mississauga, and what are the top priorities, please?
So we face an infrastructure deficit in the billions of dollars, Khalid, because there's unlimited infrastructure that needs to be built. However, we have a number of priorities that we are bringing forward, including a public marina that we would like to see built, and that is in the realm of, I want to say, $75 million. The downtown loop of the LRT is one of our largest priorities as well, and that is in the realm of probably I don't know the answer to that question. It could be $250 million, it could be $750 million, but in the realm of hundreds of millions of dollars as well. So those are the 2 top priorities. Dundas Street and Lakeshore BRT are priorities. Greening our fleets and environmentally friendly buses, more cycling lanes, etc. So there's, we have lists of priorities that we always send forward to any of the ICIP programs that funding becomes available for, and we're always hopeful that they will be prioritized. We are now all advocating for a new deal for cities, one in which municipalities don't have to go to other levels of government to ask for funding for aspirational projects such as our LRT or our loop downtown or the marina. These are projects we should have the ability to fund on our own, and we should have the right funding tools and revenue tools to do so. So, part of this request of the different levels of government is that they recognize that to build 21st century cities requires 21st century tools. Of course, cities and under the BNA Act were created, at a time where Canada was largely an agrarian country, and the municipalities were tiny, were small. But now we have large urban centers, and it must be recognized we need other means in which to, other sources of revenue in which to operate.
Thank you so much. Yes, if I can ask Dr. Lowe, please, to provide a breakdown on basis of the 1 dose, 2 dose, no dose, and children under 12, please. Thank you so much.
By percentage?
Number-wise, please.
By
or the
number-wise or
percentage?
percentage? Because those are all on the
What-
dashboard, but I think Dr. Lowe has some of that. Hang on, I'll let him come
Because
to the...
I missed that, actually.
Okay,
Thank
and
you so
all those
much.
numbers colored are on the dashboard at the Region of Peel, but I'll invite Dr. Lowe to come forward.
Thank you so much.
Thanks so much, Madam Mayor. Yeah, so Khalid, 260,000 residents that have not yet received a single dose who are eligible, 120,000 who have one dose and who are eligible for their second, and 205,000 children under 12 who are not yet vaccinated and not yet eligible. Thanks for the question.
Any further questions?
That's the final question of the day.
Thank you all for joining us. Take care.